941, a lot of folks have tattoos, right? And unfortunately, a lot of people are regretting getting those tattoos. As a matter of fact, 1 in 4 of those surveyed by Advanced Dermatology said, I might want to get that removed. Question is, how do you do it? What's the best way? Let's bring in an expert, Dr. Anne-Maria Leger with Advanced Dermatology, to share more on removing the regrets. Good morning. Thanks for joining us.
Good morning, Steve. Thanks for having me.
So how real is the regret factor?
I mean, as the study showed, about a quarter of respondents, at least, are interested in having tattoos removed. I would say, practically speaking, if I'm doing a skin exam, or I could be doing another type of laser or filler on patients regularly do inquire about getting tattoo removed, what's involved, how is the process? So it's certainly a concern.
So let's talk about that a little bit, because years ago, you really didn't have many options, if any at all. Now you do have options. What's the best way to go about the process if you do want to have a tattoo removed? Where do you even start, and what should you expect?
So you should contact a dermatology clinic, particularly people who are experts in performing lasers. The types of devices that we use now for tattoo removals, there's two that we in particular use, a Q-switch or a picosecond laser. These are lasers that specifically target pigment. So they're very effective at removing tattoos, and they have a lower risk for complications. But it is important, to have someone doing it who's an experienced professional. So,
granted, tattoos they vary, right? You got variance in colors, you have variance in size. If you had, say, one average size tattoo, I guess, what's the expectations as to how many sessions it would take or how long it would take to remove it? And can you completely remove it, or are there still remnants behind?
I always tell patients 10 to 15 treatments. However, that varies greatly depending upon two factors. One, the color that makes up the tattoo, and also who performed the tattoo. So, for instance, amateur tattoos tend to be 1 or 2 colors, like usually blue or black, and the pigment tends to be deposited in the skin more superficially, as opposed to people who go to a professional, where they often have multiple colors, so purple, red, blues, and the pigment is also usually more deeply deposited in the skin. So those two latter factors make it more challenging to remove tattoos. So as you see, I believe the viewers will be able to see this photo right now of that tattoo on the foot. That was probably an amateur tattoo, just based upon how the letters look, and it was gone in one treatment. And it was also monochromatic. It was one color, as opposed to some of these more intricate tattoos that we're seeing that were probably professionally done. They're better in 6 treatments, but they're not gone.
Sure, so, no doubt about it. So once they're gone, if you're able to successfully remove them, is there scarring left behind, or can you essentially make it look like the blank canvas it was before?
I always caution patients that the skin is never going to be normal skin. Sometimes the skin can be lighter, and sometimes it can get darker. However, over time, it can normalize, but I try to prepare patients that it might not be completely normal skin.
Yeah, well, but for some, it's worth it to get the ex's name off and not have that. It just depends. Everything's personal preference, right? So people, in a lot of cases, spend a lot of money to get the art on their body. How much ballpark does it cost to get the art removed from their body?
So that will vary on the size, but I would say to plan to budget probably hundreds to a few $1,000s.
Okay, it's good to know, and it's good to know that the options are there. If you do that, just real quick, if you do the 10 to 15 treatments for something, maybe a colorful design, how long do you have to wait in between treatments? Like, is that like a period of a year or months, or what typically would it be?
No, so the treatments are spaced about every 6 to 8 weeks.
Okay, so it is a significant amount of time.
Yes, in total, it is.
All right. I appreciate the help. Good options there. 1 in 4 people that had the tattoos apparently said that they would be okay if they didn't have it anymore. So there's some information. The info is online right there if you want to learn a little bit more about it, and perhaps go back to the way it was before, Holly. We could reverse time a little bit in some cases.
I think I might just try to maybe make it into something else. You know what I'm saying?
Do like a cover?
Yeah, exactly. Seems a lot less painful. All right, thanks, Steve. Really interesting.